Assalamu alaikum dear students. Today we are going to start electrolyte and fluid balance. In our previous lecture we have discussed the water, its role, and inshallah today we will discuss the vascular osmotic pressure and factor or the situations in which water requirement is increases or decreases. In healthy person, the water loss through urination, feces, sweating, respiratory tract, and that must be replaced in terms of both volume and electrolyte content. And in case of any illness that causes the vomiting, diarrhea, uh, and due to this result, losses of water, electrolyte. There is two type of water losses. The water losses that is through urine is known as a sensible or noticed water loss, and water losses that is through feces or respiration is called insensible or unnoticed water loss. For optimum health, there must be homeostasis, and basically homeostasis is a state of physical balance, the state of balance between opposing pressures in the body with respect to various functions and to the chemical composition of fluids and tissue. The process through which such a balance is maintained. The body excretes 500 ml of water as a urine each day in order to get rid of the waste products of the metabolism, and water is moved through the cell wall by the osmosis, and so the movement of the water is done by the osmosis. And what is the osmosis? Osmosis is basically passage or the diffusion of the water and other solvents through the membrane. Basically, osmosis is the movement of solvent from a region of the lower concentration to the region of the higher concentration through the membrane. The electrolytes like sodium chloride, potassium basically maintain the balance between intracellular and extracellular fluids. Potassium is a principal electrolyte in an intracellular fluid, and sodium is a principal electrolyte in extracellular fluid. And basically osmolarity is the measure of particles in a solution. What is a osmolarity is how many number of particles per kilogram of the solution. So number of particles per kilogram of solution, and solution with a high osmolarity is exert more pressure than if the few particles. Chemical compounds which break up into their ion when dissolved in water are known as electrolyte because each carry a electrical charge. The positive charge electrolyte is known as a cation and the negative charge is known as a anion. In the electrolyte solution, the total number of cation are equal to the total number of anions, and the electrolyte are necessary to regulate the water and the acid-base balance in the body. When the electrolytes are increases, so then ICF is moved to the ECF to maintain the concentration of the electrolyte on the both sides of the membrane. Due to this movement, the amount of water in the cell is reduced. Hypothalamus basically regulates the appetite and thirst, and hypothalamus is basically area at the base of brain. So where the body is hydrated or dehydrated, so experience the thirst. And a main role of hypothalamus is stimulates the pituitary glands to secrete ADH, and whenever the electrolyte become too concentrated in the body, in the blood, when the electrolytes become too concentrated in the blood, or in case of the blood volume or the blood pressure is too low, so the ADH is causes the kidney to reabsorb water rather than to create it. So due to this due to this reason or due to this role, uh, the healthy person drink fluids which provided the water electrolytes needed by the cell. So, and what is a vascular osmotic pressure? High concentration of electrolytes in the blood or low blood volume blood pressure. This is called vascular osmotic pressure. When the sodium in the ECF is reduced, the amount of sodium is less in ECF, so the water is basically flow from the ECF into the cell. That causes the cellular edema. Due to this reason, the adrenal gland that secretes the aldosterone, the role of aldosterone is basically triggered the kidney to increase the amount of sodium reabsorbed. So, kidneys increases the sodium reabsorption. So, when the missing amount or is replaced in ECF, or the enough amount of the sodium in the ECF, the water that is moved from the ECF into the cell back into the ECF. So, due to this reason, the edema is removed or the edema is relieved. The amount of water used and needed each day is different or changed day by day depending upon the age, size, activity, environmental temperature. The average adult water requirement is 1 milliliter for every calorie in food consumed. If the person is consumed 1800 calories, so need to drink 7.5 glasses of fluid. For optimal health, it is recommended that adults drink at least 7 to 8 glasses of water and 2 to 3 of other fluids. In case of diarrhea, fever, the requirement of water is increases.